love it if you could, yep, there's that recording thing. Yep, I do that. Um, would love to invite all of you to enter into the chat box where you're calling in from today and what your role in healthcare is. How do you sort of identify your stakeholder group for the health systems? Oh, right. Let's see. We're getting some responses in. There we go. And all right, well, we'll keep moving on. On the next slide, for those of you who may not be as familiar with us, Patient Family Centered Care Partners has as our vision to transform the health system and really reinvent it through radical collaboration with people with lived experience. And that is the foundation for Patient Family Centered Care Partners. All of us have our own personal journeys within the health system. And it was really started based on my family's navigating the health system, first in caring for my mother as she battled breast cancer, and then later with raising 3 sons who live with mitochondrial dysfunction. So it's really that perspective that we're making space for in the healthcare, specifically in the improvement, because that's what we really want to get after, is improving the health system. We hold our values very close to all of the work that we do and strive to put them into action in every partnership that we have. Excuse me, I'm still recovering a little bit. On the next slide, Stephen, could I ask you to walk us through this?
I'll jump in here. Sorry, not feeling good. This is my favorite slides to present anyways, because we've been working diligently to describe how we work, and especially the 2 arms in which we approach our work. So healthcare, hit it, Laura. Healthcare, I don't think anybody here needs me to tell you that it's complex, difficult to manage. We spend billions and billions of dollars every year, still on a system that has disparate and inequitable health outcomes in our communities. So it's as challenging and complex as it is equally challenging and complex to change and improve. Enter PFCC Partners. I'm signaling to my slide advancers here. PFCC Partners is a healthcare improvement organization that opens space for patients and families to drive healthcare improvement. A lot of our customers, if you will, are our legacy healthcare systems, hospitals, health systems, primary care groups, payers, and the rest. Those entities that have resource and knowledge that we need to mobilize through communities for advancing health equity. So there is a lot of confusion. Oh, yep. Hey.
Okay.
We're gonna get somebody on the mute button here. So that's one function in which we work. PFCC Partners helps open the space. Many patient family partners are familiar with the PFA network, which then, hit it, Laura, helps us fill that space. So as we're opening space in the health across the health ecosystem for patients and families to drive improvements, the perspectives and members of the PFA network are the first we look to help us fill that space with their impactful, the impactful people, stories, and insights that are within that network. The easy way for us to remember is PFCC Partners collaborates with health system organizations and the rest, while the PFA network is focused on the needs and priorities of patient family partners across the country. I can keep going, Libby, if you need.
I think I'm okay now. Thank you. And, just as you were talking, Stephen, I was just looking at everybody on the screen and recognizing that even our convenings here, we have such a wonderful mix of patients, family partners, people with lived experience, community members, and health system stakeholders as well. So everything we do has the patient and family perspective engaged in what we're doing. And so that's really how we get to our impact and provide the infrastructure necessary to really strengthen partnerships and mobilize knowledge. I think one of my favorite quotes from Don Berwick that sticks in my head is always move knowledge, not people. And so really, how do we spread knowledge and to improve our healthcare systems? And so we are fortunate to have some phenomenal partners that help us to create that space for patients and families. And you'll hear a little bit more about those in just a minute. But on the next slide, I wanted to kind of synthesize our approach. So I think when people ask me, you know, what's our differentiator as patient family centered care partners and really promoting implementation of a person-centered health system, I think there's a couple of things. One thing is that we are very focused on infrastructure. So we really want to build the solid foundation for engaging people, patients, family, people with lived experience, community members, and communities themselves. We're really focused on building the essential foundation by which those partnerships can be of high value and really can be sustained over time. And as well as taking kind of a quality improvement approach, if you will, to patient-family engagement, and embedding patient-family engagement as that active strategy to improve outcomes. And if we take that strategy, we can then apply it to quality improvement or improving safety, reducing sepsis. We can apply it to patient experience and HCAHPS, but it's really meant to be an active strategy to build that person-centered health system. So what's the Funfetti approach? I often refer to Stephen as the king of metaphors because he is. And one of his best was the Funfetti approach. And really, it's about, if all of you have enjoyed a Funfetti cake, you know that it is all of those flavor pieces are baked right in to every level of the cake. And that's really what we're talking about, is engaging patients and families as an active strategy through every layer of the health system, at the bedside in terms of how we're developing our care plans, but also importantly in organizational development. You know, all of our hospitals are going to be struggling with this new CMS rule to implement social drivers of health screenings. How are they going to do that? How do we do that with patients and families in that organizational design layer? Similarly, CMS themselves and our national federal partners engaging people with lived experience to understand how we use Medicare, how those services are received, and others. So the Funfetti approach is baking patient-family engagement in as a strategy across every layer of the health system. It's not sprinkled on top, right? Imagine all the flavor you'd lose in that cake if it was just sprinkled on top. And by the way, you might notice that what makes a Funfetti cake especially good is that all those chips are different colors, different flavors, different sizes, right? The diversity is what makes it really good. And so we use the Funfetti approach to engagement as we work with our partners. And with that, I think I will ask Lindsay if she'd talk about a few of our partners on the next slide.
Yeah, absolutely. And I haven't had lunch yet, and that just made me really hungry. I want a piece of cake now.
You can't have cake for lunch. Well, sure you can.
I know. Awesome. Hi, everyone. Rosie said yes, I can. So great. Hi, everyone. Great to be with you all today. Thank you all for joining. I'm just going to talk quickly about a few of our current projects. As you can see, we have a lot going on at PFCC Partners, and creating incredible partnerships just filled with collaboration in health systems, quality improvement, research, measure development, and then collaborating on patient-family engaged care. To highlight a few of them, the first I wanted to highlight was our work with Los Angeles County Department of Health Services. We are working with hospitals and health center groups, which each of those health center groups contain about 3 to 4 health clinics in the safety net of Los Angeles County, and providing them with technical assistance on how to engage the community in improvements to their hospitals and health centers. It's been a learning journey over the past few years with our wonderful partner Miguel and the team at Department of Health Services. There have been multiple formal patient family advisory councils implemented throughout the county. And we have also developed a patient family partnership hub, really an open opportunity for the community of LA County to jump in that funfetti approach in any way that kind of fits their needs, to share their perspectives and thoughts on multiple improvement projects and, disease focused projects specific to the Los Angeles County community. So because our office is located in Long Beach, really part of that community, it's been amazing to get to know the community of Los Angeles County and support them in this way. We are also a bigger focus on quality improvement. We have amazing partners at Cynosure Hospital Quality Improvement. I see we have a few of our partners from Cynosure on here today. This project is really focusing on providing technical assistance to just over 300 hospitals within 11 states across the country, and really aligning patient family engagement for equity to the topic focused improvement projects that Cynosure is also working on. So looking at sepsis and how do we engage the patient and family perspective in sepsis awareness. It's Sepsis Awareness Month, so that's top of my mind. And improving care and care delivery around processes for sepsis, and many other topics as well. This has been an incredible partnership, again, focused on supporting Cynosure, the state hospital associations and state partners that we get to work with, and all of their hospitals. We've also in this project had an incredible opportunity to work really closely with patients and family caregivers, people using their lived experiences within these states to help inform our strategy in, some of the support that we're providing to these hospitals, to the State Hospital Association, and to Cynosure as a whole. So really incredible project there. And then finally, one of our newer projects down at the bottom there, Inspire. Inspire is an acronym, and I have to read it. It is Initiating National Strategies for Partnership, Inclusion, and Real Engagement. So we have partnered with, I believe, 4 other organizations. We all have a common goal to ensure that community engagement is equitable, and that there are processes and funding behind what community engagement looks like. So right now we're in the learning phases with this project, learning from patients, family caregivers, people with lived experiences. I see some familiar faces from our buzz session this morning, so hello again. And then also learning from healthcare organizations that are engaging the community, or those that, have and it wasn't sustainable, or those who haven't taken those next steps towards community engagement. And then also learning from those community-based organizations that are directly engaging with the community, and really identifying what's working, what's not, what are those gaps, so we can create a strategy within the next year to support healthcare organizations and health systems to create really meaningful community engagement strategies. So that's just a brief glimpse of some of the work that we're doing, and you can read through a few of our other current projects there. But I know a lot of you have been engaged in 1 or 2 of these other projects as well. I know there's some folks with lived experience on who have been actively engaged in Acumen and improving ICU communication. So we appreciate your partnership on these projects as well. Thank you.
Thank you, Lindsay. And Yeah, this is just, it's not a comprehensive list of all the places that we're doing work, but Lindsay, I also wanted to mention, is our Vice President of Programs for those of you who haven't met her before, but also just wanted to give kind of a breadth of the different stakeholder groups that we're currently involved with in terms of the work that we're doing and where we're building partnerships. So, you know, when I started this organization in 2010, I thought, oh, we need to start patient family advisory councils for hospitals. And that was about the limitation of my thinking. And it's just exciting to see the number of stakeholders from across the health ecosystem who are now engaging patients and families, such as in research and measure development. Those are challenging areas, but we're making a lot of progress there. And so excited to be, again, working with such valuable, high valuable, trusting partners. It's really been a pleasure. All right. On the next slide. So I you know, one thing I didn't I didn't put a number to is the number of listening sessions we've done since 2020. I would guess them to be near or over 100. I will get that number back to you, but we've been doing a lot of listening, and by listening, we're learning. We're learning a lot of important things, and you know, with that spirit to continuous improvement, we're trying to engage and then act on those. So what I thought I'd do today is share some of the top 3 kind of key learnings that have become apparent to us over the last few years, and then kind of let you know what we're doing to try to address those key learnings. So on the next slide, I think the first key learning is about the intersection of equity and engagement. There's no question over the last few years, we've had a significant and much needed and long overdue focus on equity in healthcare. And as we've moved forward in each of those contracts that we've showed on the previous screen, we've had the opportunity to really think about what that looks like. And you see the quote there from the National Academy of Medicine. We're very aligned with their community engagement framework and the work that they're doing to promote equity in the healthcare system. And so with that in mind, for us, some of the actions that we took were to focus on inclusion to increase diversity. So we didn't want to build a list that checked all the boxes, but really rather we wanted to focus on how are we hosting meetings? What times are we putting on closed captioning? Are we getting translation services? What are we doing to be really inclusive of people, patients, families, people with lived experience? Secondly, the tie to compensation. And I've said this before, I was really uncertain about this whole compensation piece until I had a conversation with Desiree Collins-Bradley, who many of you might know is a leader in the patient family engagement world. And she said to me, you know, volunteerism in and of itself is privilege. And she's absolutely right. So promoting and providing compensation to remove barriers of participation is another way that we increase the diversity so that diverse perspectives are heard. We engage with community members in the places that they gather. This is still newer to us. We haven't perfected that by any means, but we're learning with other organizations who are really going out to community. We're building bridges with people in the communities that we're serving so that they can bring us along and move into those communities in a way that's respectful and acknowledges that we don't have local knowledge of things. So that's a really important part. And then ensure that all of our projects that we design, all of our patient family programs that we initiate, support a balanced power dynamic. And this is, again, something we've learned really strongly from great partners like National Academy of Medicine, the Camden Coalition, Patient Advocate Foundation. Really how you promote a balanced power dynamic when you have a perceived imbalance of community members who may have very vulnerable circumstances and powerful policy or decision makers in the same room. So this is something we build into again, that infrastructure. that we put at the base of all of these partnerships. On the next slide, we realized we needed to ask the question of our own community, and start to ask for registry demographics. This is new to us. We've had a new survey out for our PFA network. We've got over 1,100 now patient family partners on in the community. We've got about 290 who have responded to the survey thus far. And so this is what our demographics look like. And while this shows some improvement over the last time we did this, which was in 2020, it's clearly still not where we need to be. So we're continuing to look at how do we create more inclusion? How do we learn? Do we have sort of special interest groups within the network of people who represent communities that aren't currently represented well in our network? So continuously learning with our network about how to be more inclusive, to raise the diversity of voices involved in these partnerships. On the next slide, this also demonstrates a little bit of improvement, but again, it's new for us to be asking this question and asking this of our members. And we really had to be thoughtful about how we frame that question and let people know why we're asking. And the response is really because we want to be diverse, we want to be inclusive. And so if we don't know where our gaps are, we can't go to that community and figure out what we need to do to be more inclusive. And so that's why these pieces of information, demographic information, are really important to us, and really guide us. On the next slide, the other thing that we really learned about or responded to that intersection of engagement and equity is thinking again about this social driver of health screening programs. So these programs are getting set up in hospitals and in ambulatory centers as well, but across the country. And we really think it's super important that as those get designed, people with lived experience in those communities be a part of designing these programs. And so we've really been promoting that with our partners through the Cynosure HQuick and in other partnerships as well. So those are a few of the things that we're doing in response to learning more deeply that we cannot build an equitable health system without engaging diverse perspectives. All right. On to our next key learning. Man, I could do a whole lifetime of learnings, but it was hard to choose 3, I have to tell you. The second is that we needed to build multiple doors to engage in healthcare transformation. Again, the Patient Family Advisory Council is a fantastic format for patient family engagement. It's been in the environment for a long time, and they're very solid. They can be very solid infrastructures for partnership. But what we've learned is we have to build a bunch of doors around that. And this graphic doesn't even really depict it in its entirety. But so what we've moved to doing is nesting the Patient Family Advisory Council within larger community based events. So those might be different activities. They might be surveys or interviews or what have you, or but they might also just be an electronic version where people can respond to a request, or that we can connect with a community resource center here in Los Angeles County, which we're doing quite a bit of. So it really opens those doors. And really, where the Patient Family Advisory Councils, traditionally people like myself, when I joined the Patient Family Advisory Council at my children's hospital way back in 1994, that was a commitment I made to go to a meeting, to attend, and to partner with the organization. That was a commitment that I made through the year. And so the Partnership Hub and these other community partnerships give us the opportunity to say, you know what, you don't have to make a commitment. But if you see something that, you were working on sepsis and you have experience with that and you want to jump in, you can jump in. So it allows more flexibility for the person to kind of make that decision about where they join into. And that works really well for a lot of folks who may not have the opportunity to leave work to attend a meeting, or so it's not a either or, it's an and the more doors we can provide, the better. On the next slide, let's see. So some of the things that we've done to create more doors. One, for us, pouring our time, energy, and resources into the PFA network is essential. We really feel strongly about that, and Laura does a great job supporting our patient family partners. So we've had, this is last year, this is reporting for 2022. We haven't done it yet for 2023. We had over 500 unique touches. So people that are uniquely touching, either they're responding to an engagement opportunity that our health system partners are bringing to the network, or they're participating in skills development. And that's an important piece of raising our capacity for partnership. You know, patients and families, people with lived experience, they know that experience, but then how do we elevate that so that they can be really strong partners? They've also responded to our community events, coffee chats, very informal kinds of peer networking. And so we're grateful to have the opportunity to offer a wide variety of opportunities for people to get engaged. And then on the next slide, you'll see some of those different activities that we were thinking about or talking about. And I expect this list to grow at least by 100% over the next year, because there's a lot of different ways we can talk with people, we can listen to people. And so these are just a few different ways. Listening sessions and focus groups, you know, listening sessions to get a breadth of the problem, and focus groups to dive deep. Surveys, obviously, you know, working on committees, quality improvement committees, conference invitations and speaking engagements. So lots of different ways that that people with lived experience are partnering with health systems. All right, and then on the next slide, if we could go down. So I don't know about all of you, but we tend to fall into the trap of some like trendy language, you know, meet people where they are. Oh, okay, that sounds really good. But we kind of challenged ourselves, like, what the heck do we mean by that? What are we doing? We're all in this virtual world during the pandemic. How are we actually meeting people where they are, and really, you know, challenge ourselves to do more and better? So one of the great things that came out of that was the PFEE assessment, and huge shout out to the SignAssure team for not only trusting us with this endeavor, but more importantly, supporting with your knowledge of quality improvement and data, how to develop a maturity model that met hospitals actually where they were in a pandemic, overstressed, under-resourced, all of these things, and built that assessment in a way that was, I think, respectful of where they were, in terms of, you didn't have to be a yes, no, you passed or you failed, you succeeded or you didn't. It's a maturity model where it actually lays out the steps in that assessment. If you're here, go here next, or go there next. And there's that I think goes a long way to sort of meeting hospitals and healthcare staff where they are currently. Flexible structures, again, we talked a little bit about that, but the concept of PFACs plus, right? PFACs, yes, but plus, we do all these other things as well to open doors. Meeting people where they are, I think for me, I was most challenged to listen first. I love a good solution, and I think that I've got a lot of good solutions, so I tend to jump to that really quickly. And I was challenged by one of our board members when I put out a statement after the George Floyd murder, a statement of support. One of our board members wrote, you know, you sound really tone deaf. You haven't really dove into the problem. You haven't really. She was absolutely right. She taught me to listen first. And that's one way that we really intend to meet people where they are, listening to our health system staff members, who again are so under siege at this point. listening to our quality improvement advisors and having them inform us, help us to understand how we can better integrate. So listening first, and then co-producing tools. I think that's a really important piece, and it's become more important, I think, even since the pandemic, where we're producing tools for hospitals, for patients and families that are effective for everybody. And so on the next slide, I just wanted to share a quick example of that. This is our Ready, Set, Go. Again, it had the liberty, I guess I could call it, within the Cynosure H-Quick to really dive deep into this code production in a very authentic way. And so what we did, there's 3 measures in the Hospital Quality Improvement Collaboratives, the pre-admission checklist, bedside rounding, and discharge. And so part of that assessment I mentioned earlier was to look at where hospitals are with these processes. And we met with our patient family advisory partnership hub and council members and thought about, okay, here's kind of all the processes that go into each of these activities, right? What if we started kind of moving them around, move some upstream, move others to another place? What would that look like? And so that's what you see kind of in the messy co-production piece. And what we did was we asked, excuse me, we asked patient family partners, you know, what did they see? What do they see as the opportunities? Then we took it to the staff members and said, what do you guys think? Where do we need to integrate? We brought back that and did an iteration. And then we produced a Shark Tank where I actually presented the Ready, Set, Go tool and had staff members and patient family partners and state partners all jump in with a million questions and really refine that down. So now you've got all these folks having their hands on this tool, and now we can really confidently move that forward into the environment. So co-production is absolutely another place you authentically meet people where they are. At least that's what we try to do. All right, so that was a lot about what we're doing and what we've been doing and some of our key learnings. We really try hard around here to stick to a strength-based approach to all things. So if we're going to illuminate challenges, we're going to illuminate what we think the opportunities to address those might be, not solutions. We're not doing that on our own. We do that in collaboration, but where the opportunities are. So one challenge is sustaining progress, you know, sustaining the fact that we have moved patient family engagement forward as a strategy. And so how do we continue to do that? We think that there's a lot of opportunity for strengthening that infrastructure and, you know, using preparation, keeping parity, all of those things. Another challenge is connecting health systems to communities. And I think it's a great thing that this SDOH screening program is going to come forward. It's going to challenge all of us, but I actually think this is where we need to go if we're really going to promote healthcare rather than responsive healthcare. And so how can we engage the patient family partners we already have in the system to help us build those bridges into their communities, and thinking about some of those things. Alignment of incentives. So I said a long time ago that I would retire when patient family engagement was in medical education and in the payer system. The payer system was newer to me, but we are getting closer on medical education, but we really haven't done much to engage the patient family perspective with our payers, with our payer groups, our insurers. I think Medicare and Medicaid is starting to do that, and I hope that our private payers will follow, and we will certainly be driving towards that as well, because without that alignment of incentives, it's going to be very difficult to do the first thing, which is sustain the progress. Diversifying patient, family, and community participation. I think, you know, that's going to continue to be a challenge. And I, again, in the years previous, setting up patient family advisory councils and really focusing on that, we would often go in and say, you know, your PFAC needs to resemble the diversity of your community. And then we kind of walked out and left. So we're not doing that anymore. We've got to stay in and figure out this together so that we can authentically bring diversity into these partnerships. And I think that our opportunity is we're still listening and learning, and really striving to understand the barriers to full participation. And then finally, and this really came from our patient family partners within the network, that we've continued to work towards implementing patient and family engagement as a strategy in the health system with our health partners, with our clinicians and our hospitals and our administrators. But we haven't done a lot on the other end to really prepare the general public for that new role in healthcare, to be an active participant engaged in their own care. And so I think that's a challenge that's in front of us as well. And again, I think some of the opportunities that I'm thinking about are collaborating with non-traditional partners, that are outside healthcare. So perhaps the education systems, or other places that are more publicly, can we engage? We're in Los Angeles, so we're professional sports rich. How do we engage those groups to get messages out to the public? And so just thinking kind of outside the box. All right, well, I have done plenty of talking today. And so as stated in our registration, what we really would love to do is think about, hear from all of you. What are you thinking are the next steps for patient-family engagement? So we thought we'd do this in the form of a SWOT analysis. And to do that, Laura will in just a moment magically move us into 4 different breakout rooms, and we'll think about the strengths, the weaknesses, the opportunities, and the threats for moving patient-family engagement forward to build an equitable health system. So with that, I am going to, ask Laura to go ahead and move us out.
Right.
I guess we'll have about 15 minutes.
Which one should I go into, Laura? I got given the options.
Oh, okay. Weird. Number 3, I'll put you in there, right?
I can click it right here.
Laura, I'll stay here.
Okay, thanks.
Yeah.
Laura.
All
So
right.
you're gonna help us, right?
Yes, I am going to help you. I'm going to pull up the Jamboard, and I will share that with all of you. My computer was on vacation, so
I had voted
a little
Rosie to
slow.
take lead. Before you came on, I said, Rosie, you get to take lead.
All righty, and let's see. Can I chat just you all? Okay. I'm going to put the link to the Jamboard right in here for you, so you can join us. And then we are 4. So for those of you who have never used Jamboard, I'm going to show you real quick. So like Libby said, we're asking the question, when we think about the future of patient-family engagement as a strategy to improve health outcomes, what should we be thinking about in terms of, we are doing threats here. So to add your thoughts and ideas and all that, you just click this little sticky note, and then you type in your answer, and then you just click save, and then it'll pop up for you. And then I'll delete that. And that doesn't say anything. All right. And I will let you put your answers in there so you're not watching me type. And this is also being recorded as well. So who would like to start?
I don't see a sticky note, and I logged on.
Yeah, I don't see a sticky note either.
Okay, let me double check I've got the right share options. You don't see this one here on the side like this?
Yeah, but when I touch it, it doesn't, nothing happens. when I click on it.
Oh,
Oh, wait a minute. Here it is. It just can't,
Yeah, mine's working, so hopefully it'll work for others.
so this one that you're seeing here, this is my screen being shared.
Okay.
So if you click on the link that's in the chat, that'll bring up your own. Sorry, that is kind of.
When I do that, I don't see a sticky note,
Yeah.
but I'm working
Okay.
from an iPad, so that might be the problem.
Oh, I
Okay.
don't know how that works on iPads. That is something I will look into for the future. But yes, if you click the link in the chat, that'll be
Yeah.
one that will work for you.
Did you get one?
I
Did you get
did.
the one I put?
Oh, and move over.
I
I'm
see
so sorry,
people's-
and move over to 4. So when you click on it, it'll be 1 here. Is one of these you, Anthony?
Just checking.
So when you join the Jamboard, click over next frame to number 4. And then you can click the sticky. Sorry, I'm a little rusty here.
Yeah.
All right, anybody want to start us off? Anthony, what did you put in the sticky that you did?
That we should continue joining big measurement projects.
Mm,
I think that will help with what Lindsay said about getting private insurers and stuff on, because if we keep, I'm going to start that PQM project that's going to touch base on many things. Actually, a 3-year project, and the more we get Medicaid and Medicare involved, the more that the private insurance will be leaned on, for lack of better words, because that the private industry is subsidized by the government in the first place. So that's where we have to go to get them involved, besides direct patient demanding change.
mm. That's a great point. I think, yeah, moving up the ladder there is with patient family partners is huge. Thank
Yeah.
you.
That's our way in, I believe, since we're already doing projects with CMS.
Mm-hmm. Absolutely. Let's see. We have, not sure this is a threat, but an observation. There's very little in the way of research data on the value, ROK, and impact of patient-family engagement. It's a really good one. Who put? Oh, Linda. Do you mind expanding a little on that?
Well, I just, like I said, so she was talking about getting our payors on board, for instance, Libby was, and, they want to see what is the impact of welcoming and including in patient and family engagement, and what might be the return on investment. Why should we bother? And there's just not a lot out there. Oh, ROK should be return on investment. That was my typo.
Oh,
Sorry. Okay. Sorry.
That was my next question.
Yeah, that was, what is ROK? But return on investment, et cetera. And that's something that has been weighing with me a lot in some of the work I do, is how can we prove, how can we show impact? So that's one thing that could be a threat, because we don't have a lot of that information to offer forward. From a national research perspective or whatever. And then the other one is, boy, I am reading more and more about AI and what might be going on with that in the future. Artificial intelligence and how it's just exploding. And I don't even think we can conceptualize all of what might be coming in the next year, much less 5 years with that. So
Right.
that could be a threat situation.
Absolutely. Absolutely. Thank you, Linda. We've heard a lot about AI recently and how it can help or hinder in the future. So I think
the ethical issues.
absolutely. And getting ahead of that, I think is going to be the key. for that. Thank you so much, Linda.
A lot of your IT people will tell you that, you know, the AI is only going to be as good as the people who put things in or created. And right now there's the ethical piece is not there, and there's no ethical requirements at this point. It's kind of like ambulatory surgical sites, in that they moved faster and came into effect faster than the regulations of it. And I think that's the same thing with AI. It's the same thing with, you know, patient engagement. I think sometimes things are moving faster than we can even get to it. But to me, any engagement and any co-design or co-production that we can create on any level will improve healthcare outcomes. And I agree with Anthony where he said, you know, we have as advisors, and in that we have the responsibility of, you know, and can move it upstream. And I think that's important, that we continue to move it upstream. And, you know, and we have to be talking about, you know, how do we do this together? Because it can't be us and them, it has to be together. And that's the same with payers, I think. And I agree with the return on investments. If we can't show a return on investments, you very quickly lose people.
Yeah. I'll just make one more comment about the AI. I haven't read it yet, but the New York Times had an article that the headline is 8 more companies pledge to make AI safe, White House says. A voluntary safety commitment made by a variety of companies as part of a week of AI announcements out of Washington. So, you know, the White House is saying here, we need to have parameters. We got to start those guardrails of thinking about safety with AI. And so, you know, I think our healthcare folks and those of us who are engaging from the patient side need to try to stay aware and, you know, what is being put out there in the way of that conversation and the safety issues regarding that. So
one of the areas that I've been hearing about is diets and AI diets and young people getting, you know, not knowing, and there's some that are good, there's some sites that are excellent, and then there's other AI sites that are taking our young people down the path of being able, you know, using food as, you know, bulimic and or, you know, starvation, or, you know, basically not having controls. And so there's no controls on how, you know, what the site looks like.
Yeah, absolutely. Definitely going to be interesting, to say the least.
Yeah, I'm sorry. My phone rang in the middle of this.
All good. You're good. You're good.
I can't, nothing else is really coming up as on the threat side for me. I don't know, Anthony or and
Yeah.
Celia.
Yeah, I just, as one of the threats is that the lack of education that our consumers have around, there just needs to be a lot more effort in changing the culture and really educating consumers about the healthcare system and how to navigate it and how to navigate the insurances, what they're eligible for, what they have. I work with consumers on a daily basis, and consumers don't even understand what insurance plan they have. Do I have a Medicare Advantage plan if I am a Medicare beneficiary, or am I on original Medicare with a supplemental, and why don't I have a Part D plan? They're lost.
Yeah. Yeah. It's difficult to
Very hard to
understand.
navigate.
Yeah, very, very hard to navigate. And it's all legalese, and even I have a hard time understanding my own insurance as well. And I work in this environment, and it's not an easy thing. And I think that's a huge threat. to patient family engagement.
And
Absolutely.
as we are coming out of the pandemic and the fact that we now are no longer considered, so now people have to like reapply for things like Medicaid or for some, for, in our state, it's called Badger Care. And every day there's commercials saying, well, if you lose your Badger Care, you can go here to this site and you'll get insurance. And, but it'll be cheap, but nobody explains to people how to do that. The fact that there's, you'll be on the phone for hours and hours and hours, and that nobody,
And
we didn't put a plan in place. We didn't tell people how to do it. We
Right.
just, we just said tomorrow everybody is going to go back on regular, you're going to have to now reapply for the kinds of things that we just automatically gave you. If you had it when the pandemic started, you just stayed on it for the last 3 years. And now all of a sudden you have to reapply.
Absolutely.
it's the other threat that I see that's very real is all the fraud around healthcare.
Mm.
Fraud with durable medical equipment, fraud with people being sent, packages of COVID tests, and people don't understand that this is fraudulent. It's shouldn't be going out. What impact is that having? What, is their PHI being compromised? That's a real issue I see.
Mm-hmm. Absolutely. And before we have to go back, I'm curious if if you had any thoughts?
Trying to get my bearings. I'm new to you guys Zoom.
Yes,
I'm gonna
welcome.
try to pick up some skills, listen to you guys talk in your expert way, and pick up some of your talents and skills. So far, I'm very pleased.
Oh, good to hear. We're glad you're here.
Laura, can I elaborate on the fraud? I think we should put healthcare errors, fraud, and abuse.
Errors. Okay, yeah.
Yes.
Yeah, and
That
people
is so abundant. I'm a dual care patient, and half the time they won't even bill. Dual care means Medicare pick up like 80% and Medicaid just picks up the rest. And most of the time, you get these bills because they refuse to do the second half of it, which is put it into Medicaid. They refuse to until you call them and get angry. It's like a game we have to play 9-10 times a year. It's crazy.
Yeah.
So that's so true. So true.
And it's not a fun game.
No.
It's a very unfun game.
Mm-hmm.
Getting pretty good at it so far now, after 7 years.
All
But I
right.
think about
everybody.
all the people who don't have the ability or don't have, don't always understand it, and don't understand why do they have, a Medicare Advantage and Medicaid, and why do I have dual, and what does that mean, and how do I deal with it? And
Yeah.
Maybe that could be a future project.
well, I'm doing a presentation with the Department of Health in our state in October, to an hour and a half presentation just to discuss that and to help people understand it, because especially people with disabilities.
Yeah.
Because they wanted, and I said we need to give them scenarios. This is, if this is happening, this is how you deal with it, not just tell them what they should do, but give them real life scenarios, and this is how you deal with it in this real time.
Mm-hmm.
Case study.
Because I just think, sometimes they just giving them another sheet of paper or another direction is not going to help. But helping them walk through the scenario, or them telling us their scenario and we walk them through it.
I hope you're willing. I hope you're able to talk about that new PPO plans for the disabled that are full of, what? I don't have to say it.
Yeah, I know exactly what you're saying. Yes.
Yeah.
Yeah, and that's exactly why I'm doing this.
I just recently learned how fake they are.
well, it's so easy to take advantage of the disabled.
Thank
Yeah.
you, Laura.
All right, thank you.
Yeah.
I think we're
Pop
gonna
out.
move
Yeah,
over here
bye.
pretty soon.
I didn't say thank you to my breakout room member, so thank you for the good
Same.
discussion.
Thank you, all of you.
All right. Well, coming back together, I again, yeah, I echo Lindsay's gratitude. I thank all of you for joining us in these breakout sessions and joining us as thought partners really into what comes next for all of us for patient-family engagement. As always, PFCC Partners is dedicated to trying to bring it all together, and so we'll continue to do that. I love this picture and just had to find a way to fit it into today's session. But this is truly what
That's
we
cool,
want.
Libby.
Isn't that cool? I can't take credit,
Yeah.
Lindsay.
It's from Legoland. I believe that's over 300,000 Lego pieces or something like that. So bringing our 300,000 voices and perspectives together.
That's cool. I love it.
Exactly. Well, you can borrow it anytime. Yes, so we will be working to bring it all together. In follow-up to this meeting, we'll send out the recording. We'll also send out a link to the Jamboard. So if you have additional thoughts you want to contribute, or maybe you were focused on one board and you had some strengths to add, we'd love to hear that as well. So I appreciate all of you spending an hour with us and hearing a little bit more about what we're doing, and look forward to thinking more and partnering with all of you in the future. So thank you for joining us.
Thank you for this work, for all that you all do. Thank you.